Hello and welcome to today's webinar on addressing diversity and wellness within the strengthened aged care quality standards. Today we're looking at Standard 5, Clinical Care. My name is Dale Park and I'm the Director of Diversity Training and Consulting, and I'll be taking you through these webinar series. Before we begin, I'd like to acknowledge that this webinar is being recorded on the lands of the Wurundjeri Woi-wurrung peoples, and I pay respect to them as the traditional custodians of the land. I recognise it always has and always will be Aboriginal land. I honour the strength and resilience of First Nations peoples and communities and pay respects to all elders, past, present, and First Nations people watching this recording. In Standard 1, we went through some background around definitions of diversity and wellness, intersectionality, and how it relates to the aged care sector and why we need to be taking an intersectional approach, as well as background into the Royal Commission into Aged Care, the Aged Care Act being developed within a human rights-based approach, and the changes that were being highlighted for the strengthened aged care quality standards. If you missed Standard 1, I highly recommend that you go back and watch this introduction, as it really is quite key to setting the scene. We'll now look at Standard 5 in some detail and consider how we can address the diversity and wellness considerations that are a key requirement. As within all of the standards, there is an older people statement and a worker statement. And for Standard 5, the older people statement is, I get the right clinical care for me. And the worker statement is, I understand the clinical care needs of the person I'm caring for. Standard 5 focuses on delivering safe and quality clinical care that is evidence-based and tailored to the needs and preferences of older people. The standard emphasises the importance of comprehensive assessment and planning to address the complex needs of all older people, informed by an understanding of their diversity and what's important to them. It requires providers to implement a clinical governance framework that ensures continuous improvement and accountability in clinical care. And this is done by prioritising person-centred care. The standard ensures that older people receive care that respects their autonomy, dignity, and unique health requirements. We're now going to have a look at a case study. And again, what I'd like you to do is think about how this case study demonstrates good practice in relation to diversity and wellness approaches, and how it aligns to the requirements and outcomes of Standard 5. Robert has always been active, competing in fencing competitions and in recent years spending one-on-one time with his dog Baxter. He is living with chronic obstructive pulmonary disease, and his condition has worsened, leading to shortness of breath and fatigue. Despite his need for help, Robert has been reluctant to engage with people and has concerns over trust. Lyra, a community nurse, has been trying to work with Robert for several weeks, but he only lets her in to briefly help with his medication. Lyra understood that pushing too hard might drive Robert away, so she started with small, non-intrusive steps, making it clear she was there to support him. She spent time listening to his concerns and shared stories of her experiences with other patients and how having support allowed them to remain at home and independent. By respecting Robert's boundaries and following his lead, he began to feel more at ease with her, and he shared some further information. Robert tells Lyra it can be tricky to shower, but I'm not being washed by anyone. Lyra says no one needs to do that if you don't want it. They continue to talk, and Lyra finds out more about Robert's daily routines and where he might need support. She initiates a multifaceted care plan review with the other services Robert had referrals for but had refused to engage with. Lyra collaborated with Seema, an occupational therapist, to evaluate Robert's home for safety. Seema recommended installing grab bars in the bathroom and a shower chair to reduce the risk of falling, allowing Robert to shower independently and safely. To manage his heart condition effectively, Lyra coordinates with Robert's respiratory therapist, David, who had previously taught Robert advanced breathing techniques and adjusted his oxygen therapy in response to his changing condition. Lyra facilitated regular communication among all the people involved in Robert's care, ensuring everyone was updated on his progress and that the care plan was adjusted according to his evolving needs. We'll now look at some questions associated with this case study, and you may want to pause the video in order to give yourself time to make some notes or discuss with colleagues if you're doing this as a group activity. Question 1. How does this case study showcase good practice in line with Standard 5 outcomes? Question 2. Lyra gradually built trust with Robert by respecting his boundaries. Reflect on experiences where building trust with a client was crucial and the strategies that you have used. Question 3. Lyra tailored her approach to respect Robert's unique needs and preferences. How does your organisation ensure that care practices are inclusive and responsive to the diverse background of clients? What could be improved? Question 4. Lyra coordinated with other health professionals to ensure Robert received comprehensive care. Reflect on successful examples of collaboration and how they have helped improve client outcomes. We'll now go and have a look at how the different elements of this case study align to the requirements and outcomes of Standard 5. Lyra ensures a coordinated approach by involving multiple health professionals and regularly updating Robert's care plan on his evolving needs. This demonstrates clear roles and responsibilities within the whole care team, aligning with the clinical governance principles. Lyra's collaboration with Seema and David and her regular communication with all involved parties ensures that Robert's care plan is comprehensive and up to date, and this is really essential for maintaining continuity and safety in clinical care. Lyra's careful approach to managing Robert's medication, ensuring he feels comfortable and supported, reflects a commitment to medication safety. By respecting his boundaries and gradually building trust, Lyra ensures that Robert adheres to his medication routine, and this then supports her to be able to discuss other health issues with Robert. Lyra's ongoing conversations with Robert and her efforts to understand his daily routines allow her to identify where support is needed. Her collaboration with Seema to install safety equipment in the bathroom supports reablement and provides Robert with autonomy over his personal care. This was only made possible by an approach that was holistic and inclusive. Lyra carefully listened to Robert's concerns and preferences. She ensures that care is personalised and respectful of Robert's individuality. She could see how important it was to him that he not be washed by someone else, and potentially that could be connected with past trauma. However, she didn't pressure him into disclosing or revisiting his history. She found alternative ways to support him, ensuring his care respects his emotional and psychological well-being. This approach highlights that inclusive services can be and need to be able to be delivered without knowing every personal detail of someone's history or experience. As care providers, if a client is telling us something is important, we need to listen and respond to that. The respect that Lyra showed Robert throughout the case study also connects strongly to clinical safety. She understands his boundaries and adheres to them. Clinical safety is also demonstrated through home modifications. Seema's recommendation for grab bars and a shower chair enhance Robert's safety and independence in daily activities. This proactive approach to clinical safety reduces the risk of falls and other accidents and will ensure Robert continues to maintain good hygiene in a way that maintains his independence. If Lyra hadn't have respected Robert's boundaries and pushed hard, he may have withdrawn completely from services, and this would have led to a much worse outcome for his overall health and well-being. We're now going to play another case study, and similar to this one, what I'd like you to do is think about the good practice that you're seeing and how it aligns to the requirements and outcomes of Standard 5. Kim has been managing diabetes for several years, but sometimes she forgets to take her medication, leading to fluctuating blood sugar levels and occasional health scares. Kim has been living with her son Jimmy for a year, has been attending the Aboriginal Elders group, but now is coming to respite as her health needs have increased. Jimmy is worried she's forgetting to take her medication and asks Tammy if she can give her the medication to take when she visits. Tammy says that the staff are not allowed to administer medication, but she could prompt Kim to take her medication at the appropriate times. Tammy has occasionally had similar requests from family and thinks it would be good to have a chat with all the clients to see how the staff can support their clinical care in an appropriate way. Tammy first speaks with Kim. She wants to ensure her approach is culturally appropriate and responsive. They discuss having group discussions on managing different health issues. Tammy understands that cultural norms might mean there is a need to have separate conversations with men and women, so asks Kim her thoughts. Kim is appreciative of Tammy's approach. She says that while she didn't grow up knowing she was Aboriginal and didn't follow cultural customs, she would appreciate having the opportunity to have a yarn with just the women. Tammy discusses this approach with other members, allowing them to participate if they want or to take part in other activities. Some informal, relaxed sessions are held where the group spends some time focusing on their well-being. They discuss ways to help them remember to take their medication. Tammy agrees she will then check in with the group at lunch to ensure everyone has taken what they need to. Tammy updates each person's care plan to reflect this new practice, ensuring that other support workers would follow the same approach. Kim is feeling comfortable in a group with only women, and after a few conversations, she mentions some concerns about continence. Others in the group share their thoughts and experiences, and Tammy follows up by providing the group with additional support and information. We've now got some questions connected to this case study. Question 1. What specific practices or initiatives can you identify in this case study that demonstrate comprehensive and safe clinical care? Question 2. Considering Kim's and the group's unique backgrounds, how did Tammy ensure their clinical care was culturally appropriate and responsive? How would your organisation handle a similar situation to ensure clients feel respected and supported? Question 3. What innovative approaches did Tammy use to support Kim and other clients in managing their health? How can similar approaches be applied in your own practice to enhance person-centred care? We'll now look at how this case study aligns with the requirements and outcomes of Standard 5. Although staff are not allowed to administer medication, Tammy's strategy to prompt clients ensures medication safety by reducing the risk of missed doses and ensuring that clients are compliant with their health needs. Tammy's strategy to prompt clients ensures medication safety by reducing the risk of missed doses and health complications. By checking in with the clients during lunch, Tammy helps maintain regular medication schedules and builds routines for clients that supports them to take control of their own medication management. By organising group discussions on managing health issues and adhering to medication needs, Tammy facilitates comprehensive care that addresses the immediate and long-term needs of the clients. This practice really supports reablement and maintenance of function as clients are empowered with knowledge and strategies to manage their conditions more effectively. Tammy's individual discussion with Kim to ensure the approach is culturally appropriate reflects a strong commitment to diversity and inclusion. Tammy didn't make assumptions about Kim's preferences or what would be culturally appropriate, but checked with her. By organising gender-specific discussions, clients felt comfortable to raise health concerns and get support. The running of these discussions operated very similar to a yarn, showing a recognition in the strength of First Nations cultural practices, and that would help Kim to feel more connected to the group, but it also helps the group understand and learn more about First Nations cultural practices and see the benefit and value that they have. In this case study, we see Tammy's efforts to integrate clinical governance, comprehensive care, medication safety, and clinical safety, all within a focus on person-centered care, diversity, and inclusion. And what this brings is an enhanced quality of life and well-being for the clients. What we also see is routine building taking place, and this empowers the clients to have autonomy over their health and to not feel that these changes are difficult to manage. Tammy also updated the client's care plans to reflect the new practice of prompting medication at lunch. Therefore, it's not just reliant on her, but it's embedding that practice within all of the staff at the organisation. So we've come to the end of this webinar, and I just wanted to provide a little bit of a summary around the strengthened standards. And they really are a pivotal step forward in enhancing the quality of care provided to all older Australians. The focus on diversity, wellness, trauma-aware, and healing-informed practices really underscores the expectation for all aged care providers. It's absolutely essential that aged care providers create environments that reflect different cultural, linguistic, and religious backgrounds, as well as responding to the diverse gender identities and sexual orientations of all of our clients. The strengthened aged care quality standards are really attempting to dismantle the systemic barriers that exist for older people and shift to a more equitable and compassionate aged care system. Thank you for joining us for this webinar. If you haven't done so already, please make sure you go back and watch the webinars for standards 1 through to 4, and be sure to share these with other colleagues in your organisation and across the sector. If you're interested in accessing further support to progress your organisation's diversity and inclusion approach, please reach out to your local sector support and development team, or feel free to touch base with the sector support and development teams who have brought you this workshop, and their details are on the screen. If you're wanting to connect with me, the QR code on your screen will take you to my LinkedIn profile. Thanks again for joining us for these webinars, and I hope that they've been able to provide some further support and guidance around how the strengthened aged care quality standards need to be considered within a diversity and wellness lens.